Okay, so we're trying to actually look at lower genital tract infections. So for lower genital tract infections, we are looking at how can you be able to make a diagnosis for them, right? How can you be able to make a diagnosis for lower genital tract infections? That's various ways in which you can be able to approach making a diagnosis for lower genital tract infections. So of course, if you divide the genitals like this, okay, so this level down, that's from the cervix, to the vagina, okay, then out on the vulva, okay, all right, that's basically the lower genital tract. Okay, so it actually involves a combination of clinical evaluation. So clinical evaluation is more of like history taking, physical examination. So you're trying to also ask the patient how they are feeling. So from the information you are getting from the patient, it will give you a clue about what their issue is, right? So sometimes you can also do imagings. Okay, so the infections typically affect the vulva, the vagina, the cervix, just like I was telling you guys. And types of infections in the lower genital tract include bacterial vaginosis, trichomoniasis, candidiasis, inflammation of the cervix, that's cervicitis, okay, then sexually transmitted infections. So how you can be able to make diagnosis of lower genital tract infections has to do with history taking. So you're asking them questions about their issues, okay. Sexual histories, how many partners do they have, do they use protection during sex, okay, have they been exposed to sexually transmitted infections. You ask them about their menstruation and hygiene practice, okay. So after you're done having all those informations from them, you now move to physical examination, where you try to look at things for yourself. So Bimanual examination, Speculum examination, you inspect the vagina and the vulva to see if there's like lesions, okay. So then you still move to the lab, right? So on the lab, you check for the vaginal pH, okay. You do wet mounts to see if there's any bacteria, any fungi. That's all those microscopy do, okay, and all of that. Then Trichomonas vaginalis, right? They do whiff test. A whiff test, you basically add like potassium hydroxide, about 10% of it, okay. So if this bacterial vaginosis, you see that the fishy odor will be elevated, okay. Gram staining to access bacteria, okay. Culture, this one you are trying to establish like the exact bacteria, okay. So additional tests like pap smears, okay, point of care testings, serological testings for syphilis, HIV, herpes simplex if indicated. So that's what we have for how you can be able to make diagnosis for lower genital tract infections.